Dr. Chaudhry has been and continues to be my follower. He follows me, and Dr. Chaudhry diagnosed me back in April of 2007. He led me down the path, which included the verification of the diagnosis and then surgery on my neck to take out some lymph nodes that had cancer in that. He did a masterful job. In fact, when I went up several months later and I played golf with some doctor friends from Detroit, they asked me who my plastic surgeon was because of the delicacy that Dr. Chaudhry performed, and I said, well, no, I had my chief surgical doctor did all that, and so that verifies how good he is as a surgeon. But more importantly, he has been and continues to be somebody that follows me almost like a father does, and calls me and making sure that I have my appointments, that I don't put them off. Granted, I've worked here a long time, and Dr. Chaudhry knows me, but in talking and looking around his office, that's how he treats his patients. He really, really cares about them, and he is, in a positive way, he's kind of intrusive. But I can't think of a better way to be when you really care about people from that regard versus call me when you need me or what have you. He wants to make sure that he's all over my health care, and for that I'm grateful for him. Roland Skeel and I have known each other for almost 20 years and have worked together and on several different projects, and Roland became my oncologist, working in tandem, or in I guess it was sort of a three-person team of Dr. Chaudhry, Dr. Feldmeyer, and Dr. Skeel. And Dr. Skeel did a marvelous job in explaining to me about the chemotherapy that I was going to receive, and he explained each of the drugs that I was going to receive. He explained to me, and he was excited that he had just come back from a cancer conference, and there was a new combination of drugs that, in the type of cancer that I had, reminding people that I had cancer on the very, very back of my tongue, so that's sort of head and neck cancer, that this combination of chemotherapy drugs proved to be extremely positive in their outcomes. And he was genuinely excited about that, and he did explain to me that the side effects could be, based upon my metabolism and what have you, could be pretty severe. But it was something that I felt my general health was good. I've been a runner and exercise a lot, so I felt that whatever it was going to do to me, that the outcome was certainly worth suffering a bit of whatever. And so we decided to go with the full combination of drugs. We did that, I believe, over 9 weeks. And my chemotherapy was once a week for about 8 hours at the Rupert Center, and the nurses in the perfusion center were wonderful, and treated me, as well as everyone else there, with respect, with care, with gentleness. I read, I took some naps, I did some work, talked on the phone, but Dr. Skeel has a very soothing personality. He is very thoughtful. At one point, when I had a reaction to the chemotherapy, I couldn't swallow because I was going through radiation therapy at the time, so I was dehydrated on a Sunday and kind of delirious. And so Judy called Dr. Skeel, and he came over and came to the house, and they brought me in as an inpatient. But that that's something that I won't forget, that he cared enough to give up part of his Sunday and come and see me and take care of me. And so he's been wonderful and been a very important part of my treatment and care here. Dr. Feldmeyer has been my doctor who has overseen my radiation therapy on the circumference of my neck. In that, he is a gentleman. He is somebody that I've known for a long time as well. All three of my doctors I've worked with professionally as a marketing person and as a fundraiser. And so that certainly helped the relationship. But Dr. Feldmeyer is very calming. He explained to me what I was about to go through. And you may not know, in radiation therapy, it's extremely important that your body stays still so that the radiation hits only the areas that you want it to. So in my case, they had to make what appeared to look like a goalie mask for me, and then when you have the treatment, which I did for I think 60 days, 5 days in a row, and then 2 days off for about 45, 48 minutes, the goalie mask device just keeps my head still, so that and the staff that work for Dr. Feldmeyer are wonderful. They work as a team. They are very calming, very understanding. I had some additional reactions to some drugs that they were giving to me, but we're always very conscious of how I was doing and how I felt and how my day was going. And Dr. Feldmeyer continues to track me along with Dr. Chaudhry and Dr. Skeel. And I can't say enough about Dr. Feldmeyer and his staff on how they cared for the whole person, not just what they were treating me for.